When it comes to managing prior authorizations for medications like Latuda, healthcare providers know how challenging and time-consuming the process can be. Latuda, a widely prescribed medication for bipolar depression and schizophrenia, is effective but often comes with hurdles due to its high cost. That's why understanding the steps to navigate prior authorization is crucial for ensuring patients can access the care they need without unnecessary delays. Prior authorization is required for Latuda to confirm it's both medically necessary and aligns with insurance coverage guidelines. Without approval, patients can face significant out-of-pocket costs. But with the right approach, you can streamline the process and avoid common pitfalls. First, the process starts with building a strong case for why Latuda is the best option for the patient. This involves gathering detailed documentation, including the patient's medical records, a treatment history showing what's been tried and why it wasn't effective, and clinical notes explaining the necessity of Latuda. A thorough and proactive approach at this stage can save significant time later. Next, review the patient's insurance formulary guidelines. Each insurance provider has specific requirements, so confirming whether Latuda is covered and identifying any additional criteria up front can prevent unnecessary denials and back-and-forth communication. Once you have all the necessary information, it's time to submit the prior authorization request. Make sure to include accurate details, like the patient's diagnosis codes, such as 𝗡𝗵𝗿𝗀𝗀𝗀𝗀 for bipolar II disorder or 𝗡20.9 for schizophrenia, a comprehensive treatment history, and a clear justification for the prescription. These details help insurers assess the request and reduce the chances of delays. It's also common for insurance companies to request additional information after the initial submission. If this happens, respond promptly and provide any requested clarification or supplementary documentation. Staying ahead of these follow-ups helps keep the process on track. After the insurer reviews the request, you'll either receive an approval or a denial. If approved, the patient can proceed with Latuda, subject to standard copays or deductibles. If denied, don't give up. Appeals are often successful when stronger evidence is provided. So collaborate with the prescribing doctor to address the insurer's concerns and emphasize the medical necessity of the medication. Accurate coding is another key factor in the success of a prior authorization. Using correct ICD-10 and CPT codes ensures the request is processed efficiently. Double-check all codes before submission to avoid unnecessary delays. For healthcare providers, navigating prior authorizations doesn't have to be a constant drain on time and resources. If these administrative tasks are overwhelming, outsourcing can be a game-changer. Staffingly, Inc. offers 24/7 support for prior authorizations, appeals, and renewals, saving up to 70% on administrative costs. With Staffingly, you can focus on providing excellent care while they handle the paperwork. By following these steps, you can simplify the prior authorization process for Latuda, help your patients get the medication they need, and reduce stress for your team.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.